Joining me now is Jacob Glanville. He's the CEO of Distributed Biotech. Thanks very much, Mr. Glanville, for speaking with us. I'm sure you must have heard of Russia's announcement of the world's first COVID-19 vaccine. It's not just the Russians. I think there are about half a dozen promising candidates from the US to Europe. Even here in India, there are a couple that are under human trials right now. How far out do you believe we are from getting a vaccine?
Well, there's some good news and some bad news. So the good news is that the trial results that I've seen so far from the safety studies where they check to see how much antibody is produced was very encouraging. So the three vaccines that are in the lead are all showing very robust antibody responses that appear neutralizing in the subjects. That suggests that these vaccines will be effective. We know that antibodies can block the virus and protect various animals, mice, hamsters, and primates from infection. And these people appear to be producing antibodies that are equal or superior to those that are produced by natural infection. Those vaccines should be ready by the end of this year.
Okay.
So give or take a couple months, we're talking about January 2021, multiple vaccines will be available. That's the good news. The bad news is a vaccine arriving does not stop this crisis.
Okay.
We have multiple problems of, first off, enough people taking the vaccine. In the United States, there's 20% of people who will not take it and another 30% who are not sure. Vaccines are not 100% effective. Fauci said he would settle for a vaccine that was 75% effective. That means that it doesn't work in everyone who takes it, and particularly the people most vulnerable, such as the elderly and the immunocompromised. They're the ones at greatest risk from this virus. They're also the least likely to have a positive response from a vaccine because a vaccine requires your immune system to be effective. There's also vaccines just randomly don't work in some people.
Yeah.
Then you have cost and you have distribution problems and just global access. You have problems where we need to vaccinate the whole planet, the human population. Otherwise, this thing will just keep infecting across borders and across homes. And that's going to be a problem that's going to take us throughout all of 2021. You add all those things up I just told you, and we may not be able to establish herd immunity, which is why many experts are suggesting this may become a chronic problem in humanity and the vaccine will not solve it.
Wow, could be a chronic problem. Let's talk about, though, what's happening in the United States, because back in March and April, you had this big burst of initial cases in New York, New Jersey, the rest of the New England part of the U.S. And just in the last few weeks and maybe about a month or so, the southern states are suddenly seeing a big spike. So what really is going on in the states? Because here was this country that was supposed to be at the forefront, at the cutting edge of, solving all of the world's problems, but right now it's struggling. So
this is a complicated question with potentially complicated answer. I think you have a problem of, a federal system with lots of states that can have different types of policies with relatively open borders. I think we're also seeing, some of the consequences of an anti-scientific sentiment has been brewing for a while in the United States. And unfortunately, that's flowed over towards disinterest in adherence or even disbelief in the reality of the problem. And I think because this virus is nefarious and that most people who get it don't get that sick, and because there's a long delay between becoming infected and potentially infecting others and feeling symptoms, it feeds into the perception that the virus isn't as bad as people think, and therefore people are less likely to adhere to the rules. We saw the opposite, and for instance, New Zealand cleared out their problem because everyone obeyed the rules. They have a moat, so they were able to protect themselves, but people followed the rules. They worked together, and they enjoyed a positive outcome. The United States has a much more diverse set of opinions and ideas around the value of science and different strategies on what to do about that information. And unfortunately, we're seeing the consequence of that.
Okay, Jacob Glanville, we'll leave it at that. We'll see how this vaccine or the race to the vaccine shapes up globally. In Russia, we had this big announcement today. We've had announcements from Oxford, from the United States, Moderna there. It seems to be doing well. But like Mr. Glanville was saying, doesn't mean, even if we get the vaccine, that the problem is going to go away. On that note, that's a wrap of Brass Tacks. We'll catch you again tomorrow night, same time.